right. So welcome again and good afternoon, but also good morning or good evening to all of you for this thematic innovation ecosystem on green health organized by the ECH Alliance. This one is, we want to explore the issue of sustainable healthcare facilities. And as this is the first meeting or first official online, we will start with practical beginnings. So where to start if you're a region, a hospital, or a company, how to support the sustainable healthcare. And we will hear three examples from our colleagues, Christina from region Southern Denmark, Shane, who comes from the Memorial Sloan Kettering Cancer Center, and Paul from the company Thematic. I will give a very short introduction together with my colleague Andy from Communities team of ECH Alliance, what actually we're doing with this thematic innovation ecosystem. And then we will hear from Christina, how to start from your region, from Shane, how to start in your hospital, and Paul, how to start in the company support or actually like working with the value chain. And this is the Zoom meeting. Ask you to be respectful and keep yourself muted when not speaking, but also to connect via and your organization in your name. That would be great. And as for disclaimer, this meeting is recorded and the recording will be published on the ECH Alliance YouTube channel. Colleagues Adriana and Ines from Communities team that will support, and I will moderate. And maybe just one word on this green health thematic innovation ecosystem of the ECH Alliance, where this actually, what does it do? We will hear from Andy where this belongs in the ECH Alliance organization and why it's important for us to organize meetings of this kind. But just shortly on the green health, or what we want to work towards is to help decarbonize health system, help promote green IT for digital globally, and of course also discuss the issue of green skills, so invest. And then maybe I will pass quickly to Andy to tell us how it fits wider context of our organization.
Hi, thanks for that, Caro. Welcome to all of you. It's good to see so many of our members here. And I'm pleased that we're showcasing Thematic and also colleagues and members from South Denmark too, which is fantastic because that's what we do. We're as many of you know, we're the Global Health Connector. We're a member organization with over 1,100 members that are organizations that are members of us. We bring them together in a network of ecosystems. I'll show you where those are in a moment. But primarily what we do is work with our members. So we make sure we connect them, we convene them together. We also amplify what they do and we accelerate and hopefully speed up adoption of innovation. Today is about that amplification piece and a little bit of connections too. So we bring in two, I think, really good case studies from our members. But in terms of our ecosystems, we'll look at where and what we do with our ecosystems. Ecosystems, we think are quite a simple concept. Many of you have heard me say this before. This is about matching need and solution. We bring our members together in permanent multi-stakeholder gatherings that break down silos in healthcare. On this case, on sustainable healthcare. They match need and solution. They also look to transform healthcare delivery. And then lastly, there's an element there about creating economic growth. The idea behind these ecosystems is they bring all the stakeholders, as we're doing today. We've established a network of these all over the globe, from Argentina to Zimbabwe, from Zimbabwe all the way over to Australia. And there's well over 80. We've just opened 11 of them this year, which is great. But we've also established a network of what we call thematic ecosystems. These are horizontal in nature, so they're much more cross-border. We've got a fantastic example that the Danes led in South Denmark with Australia on skills for health, looking at workforce, etc., but also in many other different areas, looking at a cross-border collaboration opportunities, project opportunities, and also commercial opportunities in a number of different settings. This year, we're switching that focus to a number of new priorities. One will be healthy aging, one will be women's health, one will be data and digital, and then today, obviously, we're looking at green health with Caro. But you'll see there are a number of different opportunities. I'm going to hand back that to Caro. That's it from me.
Thank you so much, Andy. And yeah, I hope that now you have a bit of better understanding what do we want to do here is to connect needs with solutions, but also to raise awareness to the topic of the green health. And we've heard from many organizations, from many regions, from many of our members and partners that great, but where to start? So again, this is what we dedicate the session for, practical beginnings. And I would like to then Christina Kierkegaard, who is the project manager for green transition at Region Southern Denmark, to share with us how did you started in Southern Denmark. And for all of you who joined us when we were doing the introductions, please put your name and your LinkedIn profile in the chat so that we can connect with all of you. So Christina, you're please share your.
Yes, hello, and thank you for the opportunity to share some of the ideas and how we have structured the work here in the region of South Denmark. I will take you through in a quick journey here. First of all, I like to start off with my own journey from an OR nurse in an orthopedic department to a project manager.
Christina, excuse me, can we get your slides full screen? Like, can you click this in this link for visiting?
You're not seeing the slide?
No, we see your notes as well. Just go there up,
yeah.
And I think that was it. Yeah, this one. And I think, no?
Mm-hmm.
Okay, no.
Or it might be Asflud slideshow, maybe.
Can you try again? Maybe we can help you navigate the.
How are we doing now?
We don't see anything. Can you start sharing your screen again? Yes, but then we need you to click the slideshow on the bottom of the. Mm-hmm. Yeah, we still see your, okay. Oh, perfect. Thank you.
Is it perfect?
Yes, perfect. Please go ahead.
We'll take it from the top again. I just want to share quickly my story from an OR nurse in an orthopedic department to a project manager where I am now. I was working in a plastic department where we replace hips and knees. And this generated a lot of plastic waste. And I started a project of sorting plastic in the OR, and that project spread to the entire hospital. And in that process, I got in contact with the people of the region. They reached out to me when they formed this department of green transition, and now I am assisting the hospitals across the region with projects that support the green transition. And I would like to take you through some of our starting points and our political objective and sub-strategies, our lead functions, our incentive structure and some of the challenges, and just finish up with a few of the projects currently going on. The political objective here in region of South Denmark is to reduce the total emission of greenhouse gases by at least 35%. And this is for scope 1, 2, and 3 in 2030 compared to the 2020 baseline. And some of our assumptions with mapping out the organization for green transition was that it requires fundamental and completely sweeping changes in our way of thinking and running the healthcare system. And the efforts must be integrated into the normal system and not left out in the technical department. And we have to have the clinic actively involved in the development of new climate solutions. And this is some of the key factors that must be present for us to reach this objective. We have divided the action areas into different units. We know that the green transition weaves into all parts and cuts across operations. So it's crucial that the units become central players in this green transition. And based on that, we have distributed a number of main tasks and areas of effort to the various units. And the units responsible for a given area has the lead on the task, which is illustrated with a yellow jersey. And the individual lead must ensure progress and anchoring, scalable projects that can be continued, dissemination of results and experiences throughout the region. And all hospitals are part of the steering group, and the regional director is the chairman. We have formulated 21 lead areas and split them between the units and the center of green transition. And more concretely, to have lead means that the unit has the yellow jersey and is responsible and takes ownership of the climate effort in this particular area. And this includes that they map and analyze existing knowledge and results. They describe and implement projects so they can be scaled to the other units, and possibly scale up already existing efforts, working up procedures and routines that ensure that we go from project to operation, and then evaluate and communicate the results to the other units as well. As part of being able to meet the 35% target, the region of South Denmark is in the process of preparing 6 sub-strategies, which must describe sub-targets within the 6 areas and describe which efforts can contribute to achieving the sub-targets. And this is all the 6 sub-strategies you see here. And eventually they will replace the existing strategy for green transition in the region. And of course, if you have any questions, just feel free to interrupt me. This is kind of the foundation of the organization and how we have done it. The projects will be part of a sub-strategy, which is rooted into the lead area. And they all stand on a common foundation of projects, which should create kind of a synergy across the units. Somewhere along the way, we are not there yet, but on our way. But this is the overall organizational thought. And all of these projects requires data, which definitely is a challenge for our team of data specialists. And to get hold of the correct data, to make the LCAs, we need to go back to the clinic and tell them how much impact a change will provide. So that's some of the great challenges we face. Because when we look into the climate accounting of the region's consumption, we divided it into individual subjects, and this is also for scope 1, 2, and 3. We're used to hearing that we need to take the bike instead of the car and switch to LED bulbs and so on. But in reality, when we added up the region's emissions, it was the goods we consume and the medicine we prescribe in the hospitals that filled up in the climate accounting. And this was kind of a surprise for us. We're also building a new hospital in this region, which takes up a bulk, but it will be finished eventually, and then we are left with the goods that we buy and the medicine. So that's really where our focus needs to be. We need to start moving from a linear economy to a circular one, and we have to think about the entire life cycle of the project from the design phase. So we already there think about how the raw project is recycled. We have to bring down the amount of waste. We have to think about a transition from single use to multi-use, and we have to purchase products with a less climate impact. In these two pictures, we have moved from reusable to disposable on every project, except for the gloves. OR hats and masks, gowns and suction cups. Single use is very good in the sterile environment and has its place there, but not everything needs to be sterile. So the reuse of products and textiles have found to be better for the environment in almost every study made. In Denmark, there's a study going on right now trying to find the right coating of sterile textiles because PFAS has been used, and of course it's not a good choice for the environment as contributing to burden shifting. But textiles is one of the areas we're looking very much into. And one of the first projects I started up here in was the hats, the surgical hats, because this is a project that doesn't need to be sterile. We calculated that in this region, 200,000 operating hoods go up in smoke when patients are operated, and after use, the hats are discarded and sent for incineration. It's resource intensive, and it affects the hospital's CO2 footprint negatively. So surgeons and nurses agreed to test the reusable hats in a period of 6 months. In this experiment, they tested hats made from recyclable materials, and it shows that it provides the same clean environment in the operating room as the disposable surgical hats, and it's a cleaner choice for the environment than the disposable hats, and it reduces the amount of waste after an operation. So at the moment, the data is being calculated, and we hope to present for the steering group in January so we can scale this project of reusable hats to the rest of the region. Another project I'm working on is to make green requirements for the procedure packages. The packages are used every time a procedure is done in the hospital throughout the region, big or small, and a package can contain a lot of single-use equipment like plastic and metals. So green requirements must contribute to removing equipment from procedure packs that are not used every time, change from disposable to reusable equipment where it's possible, demand equipment that can be recycled, avoid that the equipment contains unnecessary chemistry to reduce the amount of waste, and to influence the market to produce greener products. Another project going on is the testing of blood test tubes. We are investigating in the moment whether the plastic from the blood test tubes can be used several times. It's made from the highest quality plastic PET and is burned as hazardous waste, and many thousand kilos of plastic is wasted. It's expensive, and it leaves a negative climate footprint. So in this project, the plastic must be cleaned and remelted to see whether the tubes can be emptied and cleaned of blood, so the plastic can be reused without compromising the safety of patients, hygiene requirements, and the quality of the PET plastic. Another project is Stop Medicine Waste, which is going on in a unit as well. A new project which maps the medicine waste to see where to put in to avoid medicine being wasted in the unit. And last project is the spray inhalers, which contain so many climate damaging gases. It makes sense to see that people with lung disease can use powder inhalers instead of spray. The inhaler project will investigate which patients with lung disease that can switch inhalers without compromising the health and the quality of the treatment. And of course, gloves is something that we are very fond of and that we use a lot. And the best thing is to reduce the consumption of gloves, but we also have to look at them innovatively. And that's why next year we're starting a new test to test this ReGlove, which is a reusable methyl glove. It can be washed up to 8 times, and they have developed a new method that can wash the gloves on both sides, check the fabric, and send them back out to be used again. They look and feel like single-use gloves and come in different sizes. So we're very excited about this new project. Yes, questions?
Wow, super. Sorry, I've heard that my video was jumping in the introduction. Sorry for that. I hope it's a bit better. Thank you, Christina, for this those gloves testing and experimenting. That's a great example. I saw also lots of different logos of the companies and technological institutes. So of course, this shows that also you have the wide ecosystems around there to innovate and implement it.
Exactly, yes. Yeah.
So maybe just like coming back to the practical beginnings, and you said about the political objective, and you also said that, do you want to comment a bit more on that? Like, do you have a, like, I don't know, a story or something, where this all started and how many years did it take, and what was the factor to succeed in this?
It has taken some years now. The baseline we are going back to is the 2020. So at the least, the 3 years that has been going on now has been just with the structuring of the green transition throughout the region. We really want to use this method where we push the green transition into the normal system of the hospitals. So it's not left out in the technical department, but you need to infiltrate it into the normal way of thinking. So it's the clinicians which is the drivers of this green transitions. We have to get them aboard, otherwise we can't really make it.
Mm-hmm.
But it's a long process.
I'm sure it is. I don't know if there is any, and I will just remind you all about the chat. There is actually like lots of different comments, and thank you for introducing yourself. So Christina, there is some comments to you that the very interesting presentation and good job, and so
thank you.
Thanks
so
for now. And I don't know, is there any immediate question to Christina to clarify something, or do we move forward and we then come back to discuss it later? Is there anyone who has Okay, I will just only pick up from the chat one maybe call to action. So also staying in the Nordics. So Nima shared with us that he is in the program council for the 6th Nordic conference in Malmö, 15th of October next year. And we can let him know if anyone is interested in presenting and collaborating. So the Nordic trade promotion organizations also plan to have a side event in Copenhagen at the UN city. So this is the call to action. Happy to share this here. And also Hannela shared now the responsibility nursing in hospital. Super, thank you so much. This is actually this platform, this thematic innovation ecosystem. This is also something for us to share and crowdsource. So there's good practices and ideas. So today we hear from Christina, Shane, and Paul, but we are happy to always highlight your work and your practices. So now I will move to Shane. I think Christina gave us already a good background, and probably Shane, you give things that she was talking about in your work coming from the management of the hospital. So tell us, how does it look? The story looks from your perspective as the manager of the hospital. How can we start to making our healthcare facilities more sustainable.
Sure. And happy to be here. Appreciate being able to join everyone. Let me just share my screen really quick. You guys can see.
Yeah, full
Get
screen,
off this
please.
full
Yeah,
screen.
perfect. Thank you. Yeah, perfect.
Excellent. So I'm going to take you through just a little bit of an overview of our program now, then kind of dip into how it started, talk a little bit about our governance structure, the stakeholders that we have involved, the really high impact, low hanging fruit opportunities that we plugged into some of the governance structure, the program framework, and just how it all developed, and then kind of end with a bit of kind of the maturity that we're looking to continue to increase in the sustainability and climate space. So Memorial Sloan Kettering Cancer Center, to orient us geographically, world's oldest and largest private cancer center, more than 130 years to world-class patient care, innovative research, and educational programs. We have over 30 facilities that are throughout New York and New Jersey, states on the East Coast here, northeast of the United States. We have a long-standing commitment to sustainability at MSK. I am the Associate Director, the Program and Department Lead at Memorial Sloan Kettering, and we really look at it to take a three-pillar approach to drive environmental, social, and economic stewardship through sustainability efforts for the benefit of our patients, staff, and community, all in support of MSK's mission. So we link with our core values. When we talk about getting started within a hospital or a health system, the sustainability efforts, climate action, promotion of human and population health, reducing our environmental impacts, we link, and you can link to so many of the charge of do no harm within healthcare, or core values like, for us, respect for the individual, everyone's contribution matters, innovation with lasting impact. You heard me talk about the different stewardship aspects. And then we have a comprehensive program framework. We've been at it for about 10, 11 years now, and we now work with departments and leaders across the organization on things like climate action and resiliency, energy and water efficiency, waste management, reduction, diversion from landfill and incinerators, more strategic and sustainable sourcing practices throughout the supply chain, the design and construction of our buildings to green building standards, even food and nutrition, more plant-forward meals, better education for staff on how to promote the health of their food and beverages, linking with the environmental impact, and then comprehensive stakeholder engagement. We're an industry leader, lucky to say this in the States here for sure. We've been recognized as a top 25 organization for sustainability in healthcare the last 8 years it was given. We design all of our buildings to this U.S. Green Building Council leadership in energy and environmental design certification. And we've been recognized for top 10 programmatic efforts for some of the areas you see here. But really, what we are so rooted in as healthcare professionals, we have such an important role to play, as all of you know, in reducing our environmental impact, including greenhouse gas emissions from our operations and from the purchasing and our operations throughout the supply chain. The call to action, when we talk about engagement, and we're always talking about how we're getting this started kind of today, linking it to reducing our environmental impact, and I'll show you how we save costs to do that, but how we look to have a direct impact on the promotion of public health and also the resiliency of our hospital and health systems. So US healthcare makes up 8.5% of all US-based greenhouse gas emissions, and US is 27% of the global healthcare climate footprint. We don't treat 27% of the world's population. We just have incredibly intensive patient care delivery and operational aspects. So we talk about climate change can exacerbate vulnerabilities for certain populations that have possibly socioeconomic factors or demographic factors, or for us, health status. Everyone we treat is impacted with cancer, immunosuppressant patient populations that can be exacerbated by climate change with these climate sensitive health risks. so much, the call to action throughout global kind of medical journals to keep average global temperature under 1.5 degrees Celsius. So this really a call to action and understanding our contribution to climate change. This is where we talk a lot with leaders and engaging people on our outsized impact on the climate, and then where our impact is, as scope 3 throughout the supply chain can account for as much as 60, 70 to 80% of our total emissions for everything that we're purchasing, everything that we're building and constructing. So we look at it as a collaborative effort for everyone within the industry to work together. So back to the beginning, how did we start? The financial crisis, the great kind of the recession that we had around 2008, 2009 really had some of the budgets in poor financial state here and across all organizations throughout the United States and rippled around the globe. So really our leadership brought to the table, how can we save money? What are some ideas? Anything, bring stuff forward. We had some leaders that said, we spend a ton on energy and we spend a ton on waste. We consume a lot of energy. We generate a lot of waste. We purchase a lot of supplies. We should start a green environmental program. So we had a mission statement for sustainability initiatives, focus on our impact on the environment. We focus on energy use, material consumption, and waste to create a healthy environment for our patient, staff, community. You see where we ended up at the start now that we're driving comprehensive 3-pillar approach, working on climate action, all of this, but it always has to start with those really tangible and kind of low-hanging fruit. And a lot of that is energy, supply chain, material consumption, optimization of supplies, alternative materials, reducing our waste, and kind of diversion efforts. We committed to a New York City carbon challenge to reduce the climate impacts of our building energy use, and aligned with this organization practice green health here in the States that helps aggregate successes of hospitals and provide best practices for organizations that are members. So where to get started and things like that. You have to be organized in the folks that we educate, the folks that we engage. So I just pulled, we didn't follow this one particular, but the American Hospital Association and the American Society for Healthcare Engineering have a roadmap to talk about establishing a sustainability champion, someone that everything can kind of go through, that can be the point person, having educational resources. You saw some of the climate pieces that we have there. There's so much that's available throughout, but then making defined KPIs and metrics and tracking your energy usage and energy use profiles, calculating the greenhouse gas emissions associated with your energy use, associated with your anesthetic gas purchases, associated with your refrigerants in your fleet vehicles, and then having a either green team or steering committee, representative leaders for the different aspects of a sustainability program that you're looking to impact. And then, different things on setting goals and targets, distributing kind of communications plan, and creating a sustainability plan. So at the highest level there, but what does it look like here at MSK with our organizational structure? I scrubbed some names and stuff like that, but we have an executive leader, and then myself as the sustainability leader, and then we have one really half FTE for sustainability support. There's over 20,000 staff members at Memorial Sloan Kettering, but we have essentially 1.5 sustainability full-time equivalents. But we use a committee-led structure, and we have over 500 staff members on sustainability-related committees, putting together organized projects and programs that can come through this committee structure that impact reducing the impacts of our operating room and patient care areas and our laboratories, and then representative programs for anyone who wants to be involved in sustainability. And we still do have a paper reduction committee continuing to move the needle towards the digital transformation. So a couple of these are busy for sure. This is just a representative sample of our sustainability steering committee. So what we did is I report to the head of our supply chain for our ability to impact throughout the supply chain. We also have another co-chair of this committee who is the vice president of essentially our energy and built environment plan operations. And then we have representative vice president and director level representation for those areas that align with our program framework, like plan operations for energy and our digital transformation within our information systems. We have surgeons and nursing leadership and environmental safety and environmental services for our waste related efforts, and different design and construction for the building and construction, food services, and our supply chain sourcing and materials management, and so on and so forth. So we have people that are able to intake and help develop and implement projects, programs to advance sustainable practices. So what's execution in one of these committees look like? We have a Greening the Operating Room Committee focusing on climate action, energy, waste, and procurement practices to limit impacts in surgical and clinical settings. We made sure departments represented were a good diverse representation of who helps lead sort of the perioperative suite with other folks that are subject matter experts in leading efforts across the organization. We were recognized for an industry-leading Greening the OR program, this Practice Green Health, which is a sister organization to this organization, Healthcare Without Harm, which has a global kind of impact and presence throughout, suggests kind of looking into them. They're wonderful and collaborative. So what we do through that, we don't only measure the impacts, we measure the costs that we avoid to help get additional buy-in. So when we look at this infographic in 2022 at one of our facilities, through setting our heating and cooling HVAC air exchanges in 28 ORs to reduce the air exchanges overnight when the operating rooms aren't in use, using smart controls, and switching to LED surgical lighting and medical device reprocessing, collecting items to be reprocessed and purchasing some of them back at a discounted rate. You heard Christina with the wonderful examples about kit reformulation, the procedure kits, always looking at those with our vendors to reduce ones that aren't being used and getting them removed to reduce waste and purchasing costs. Less climate intensive anesthetic gases. We've actually reduced some of our anesthetic gas consumption, limiting blue wrap with reusable sterilization and fluid management systems. We saved over $1.1 million in 2022 alone at our major memorial hospital through these Greening the OR programs. That gets people's attention and it asks, how can we do more? So we really are using this, in this case, the financial impact, because it's such a intensive area of our hospital. That's where we like to start, the operating rooms and those direct patient care areas. But everyone we want everyone to have the opportunity to be involved. So we have this grassroots approach, this thing called the Green Reps. Anyone who wants to be a volunteer representative of sustainability at Memorial Sloan Kettering can be a Green Rep. We meet quarterly via Zoom in a meeting like this, that we have presentations and different people come in that me and my team help lead. And then we have almost 400 individual volunteer Green Reps across MSK helping drive sustainability efforts. So we don't have a big team, so we created resources of people that are passionate and want to be involved. And these folks we organize into task forces by site. We highlight folks that are making a difference, everyone from software engineers to research assistants in our pathology and laboratories, to nursing staff, to our plan operators. And then we produce quarterly newsletters to disseminate to all of these folks that we ask them to pass to their colleagues to show what can be done at MSK to follow and align with these programs and educational resources. So we help kind of amplify that. And so much of it comes back to our goals. I'm not going to spend much time because I'm trying to stay in the next kind of few minutes here to stay within the 15 minutes or so. But we set SMART goals that align with our program framework for energy efficiency and waste diversion, recycling and regulated medical waste, like maximum and minimum percentages, the design and construction of all of our buildings to certain standards, supplier relationship management for sustainable practices, and food and nutrition. A minimum spend of all of our food has to be from sustainably certified or local sources, staff engagement, and staff participation goals. And then we have comprehensive, all-encompassing climate action and resiliency goals. And this is aligned with the U.S. federal government put forth the Health and Human Services Department a climate pledge to reduce organizational scope 1 and 2 emissions 50% by 2030 and chart a roadmap for net zero by 2050. Over 900 organizations have signed on to this throughout the United States to really aggregate and go to move the needle, and then make sure that we're inventorying our scope 3 emissions and developing climate resiliency planning to ensure continuous operations by a specific date. So all of this really helps the industry get aligned. We set strategic plans that kind of really aligned efforts that are with our program framework. We set one in 2019, and then of course, right as we were implementing, March of 2020, COVID pandemic, everything got turned upside down. So we continue to recalibrate and, continue to just look to move the needle. This is just a profile of climate, energy, and water, some of the things that we look to do from a strategic end in reducing the consumption of energy and water, meeting certain laws and compliance standards. New York City actually has caps on the amount of energy per square foot to use, or else fines will be assessed related to the greenhouse gas emissions from those buildings. So the regulatory environment's increasing in some of these forward-thinking cities and such there. So we track and trend our greenhouse gas emissions and continue to promote and use a data-driven approach to track and trend across all of our focus areas. We developed an really a fancy Excel spreadsheet to calculate our greenhouse gases using publicly available equivalents. We do this for all of our scope 1 and 2 emissions and have an inventory management plan to calculate our emissions from anesthetic gases, refrigerants, our whole fleet vehicles, and then all of our energy really consumed scope 1 and 2. Allows us to really track and trend across the organization. And it also gives areas where you see emission spikes usually correlate to inefficient buildings in ways that we can upgrade the built environment or have energy use that saves costs, saves energy, reduces greenhouse gas emissions. So I know I'm going kind of quick here, but other mitigation efforts, we have an internal sustainability report that puts forth, this is just a snapshot of one of the pages on climate action resilience, how we've met our goals. We've actually reduced the energy use intensity per square foot. So the amount of energy we use per square foot, we've reduced it 58% from our 2007 baseline. So we've doubled our size over the last 10 years, but we've halved our greenhouse gas emissions per square foot, which essentially kind of keeps us flat, but we didn't double our emissions while doubling our size. We continued to build efficiently while reducing our more inefficient spaces. And we do things, we're building solar arrays and things in our regional sites. And we source a third of our electricity at our main campus from hydroelectric through New York City. We have a 27% reduction in the emissions from our anesthetic gases by reducing and almost eliminating desflurane, by having more efficient delivery of nitrous oxide, things like that, and many other efforts that we have through energy waste and sourcing and food nutrition and so on and so forth. So here in the States, organizations are aligning and really taking the industry approach with collaborating with one another that we all want to see, that we're all here participating in, through organizations like this, the National Academy of Medicine with action collaboratives on decarbonization, Healthcare Without Harm and Practice Green Health, and the Institute for Healthcare Improvement, IHI, and climate work groups. And then that HHS pledge, like I talked about, has tangible climate commitments that over 900 hospitals, health systems, pharma, suppliers, and stakeholders have pledged to. So you're not in it alone. We're working here in the States and making sure we try to keep pace. And, that's really just a bit on, the governance, how we pursue some of the areas in an organized approach. I didn't go as much into specific projects because there's so many going on all the time, but happy to answer any questions.
No, thanks, Shane, for this. And I'm definitely when I was picking up a couple of points for this, where to start, right? I mean, in your case, you said that it was also financial crisis, so it was the need to save, actually.
Yeah.
but also this low-hanging fruit. So maybe, of course, you now, like you said, it's very comprehensive and going the metrics, monitoring, working on so many different projects on so many different levels, building solar power, solars, and so on. So so if someone would like to start and see of this, might be overwhelmed. But
Yep.
hearing this, like that, you know, you also at the center, you also started somewhere, and this actually came from the need to save money, right? And as you
Yes.
said, yeah.
And one area we
yeah.
started, we worked with an organization on this HVAC setback that reduced the air exchanges in our ORs, and the return on the investment was incredibly fast. It was like a year or two, and after that, we were saving hundreds of thousands of dollars and greatly reducing our energy footprint. So a focused effort like some of these are good places to start. Reprocessing is a great place to start. Energy for heating and cooling, kit reformulation, some of those ones you heard are great places to start.
Yeah. And then there's a question actually from Paul, like, are you finding variations from state to state around commitments?
Yeah, for the geography definitely matters. Some of the political climate and things along those lines. There's more drivers, you know, in the east and west coasts of the United States for sure. Not saying there's none elsewhere. There's a ton of leaders throughout the country for sure, but different states' regulatory environments dictate kind of the aggressiveness that people need to pursue some of these efforts. But one thing that we're trying to do, and the reason I bring the dollars here, is we try to equate it to the business case and have it make sense for people to just not be able to say no. For sustainability to be a core component of healthcare operations, because that's where we're at. We're strategic efforts through it. So even if a political or environment varied, who's going to say no? The need to save money and costs on budgets is ever present for all of us in healthcare. So it's tough to say no, you know.
Okay, brilliant. Thank you for now, Shane. Thanks for
Sure.
sharing this. Again, very comprehensive. Okay, we have a hand raised from Ein.
Yes.
Please go ahead, Ein.
Thank you, Shane. Wonderful presentation, very clear and also very inspirational. I'm wondering, has anyone in your organization looked at the energy consumption per patient treated? So that when you say that you have expanded twice and kept the energy consumption at the same level, so what is your thinking, and you know, do you see any research in that direction as well? Thank you.
Yeah, so we actually, for some of the applications that we put forth to these practice greenhouse, one of the normalization metrics are impacts per patient day, waste generated per patient day, some energy used per patient day or per OR. But one thing that we're doing, that's a great question and point, because we have performance metrics that track OR cases, patient days, infusions, so on and so forth. We're looking to take this strong data set we have and layer it on top of our performance metrics to get another even more substantial view on how not only the operations of our buildings and environment, but who's being treated and how they're being treated in these facilities equate to the impacts. So that's something that we're going on the journey right now. So far, normalization's been more around the patient day because it's such a widely used metric.
Thank you so much, and yeah, thumb up from Ein and from all of us. Thanks for this, Shane. Now we will move to Paul, because we also want to hear. So Paul, called Thematic, so developing actually the big part of this value chain. So when we know that actually we can work with value chain to reduce the greenhouse emissions and carbon footprint of the healthcare. So Paul is on that side. So I invited him and asked him to share his story, like how did he realize that this actually makes sense, that producing, developing, selling devices that are helping you in regions and hospitals and healthcare facilities to actually reduce carbon footprint. So Paul, do you want to share your story?
Super, thank you, Caroline, and thanks everybody. And great slide deck so far, guys. Well, brilliant. And look, I hope I don't repeat some of the messages here, but you know, I probably will, but bear with me. So give me a second. I'll just share the screen.
Yes, here we are on the presentation.
There we go. So yeah, hi folks, Paul Malloy. I'm co-founder and CFO of a company called Thematic Limited. We're a Belfast-based manufacturer of medical devices. Primary device is a non-contact infrared thermometer, which everybody will have become familiar with in the last few years. We brought the idea from concept to market within 18 months. Specialize in products there are hospital grade products. Design, we consulted with practitioners, nurses, etc. to make sure that we come up with the right design for use within the hospital setting. To that end, we consider ourselves very responsive to market needs, and we take feedback, and we're developing our next generation of device, which will be the connected version of this. We're moving more towards the digitalization side of things and the data side. We have distributors in 21 countries, mainly across European regions, and we've launched into the US this year. Shane, so I may come knock on your door at some point, if you don't mind. I'm maybe going to repeat some data here, but it's just to size the problem and put some context around it. I've taken some data from a report in 2019, the ARP report. So the key things I found here I thought was really significant was just the size and scale of the problem. Healthcare industry globally is responsible for 2 gigatons of carbon dioxide each year, equals 4.4% of net worldwide emissions, equivalent of 514 coal-fired power stations. And they conclude with if the healthcare sector was a country, it would be the fifth largest emitter of greenhouse gases on the planet. And I think that's kind of a key message here when you start to think about how healthcare is. It's a massive opportunity for healthcare to look at this and do something about it. Some of the conclusions of that report were, the key thing is to align the actions of healthcare with the trajectory of the Paris Agreement. Talks about the Hippocratic Oath and first do no harm, and how that should be taken into account, and thinking about the planet and the impact it's having on people's health as we move forward in the current trajectory. Taking action towards the goal of net zero is achievable. Talks to you about the 10% of the world economy that healthcare represents. Healthcare development, growth, and investment can align with the global climate goals, and that healthcare should show leadership towards low carbon and climate smart, more equitable, healthier future. Just took this and I put it up. I was looking at the sort of the three scope areas, and I was shocked when I looked and I saw 71% of the contribution towards carbon comes from scope 3, and that's kind of the area that we sit in. I mean, 17% from the fossil fuels and the building and the sort of direct cost of the healthcare. And by the way, a lot of my references here will be to the NHS, although we do because that is that's our domestic market. But scope two representing about 12% of carbon footprint. 71%, I guess we sit in that space, and I guess that's some of the contributions we can make towards helping on the challenge. I guess from a supply chain, that scope 3 area, then decarbonisation of healthcare supply chain is key to making a major change to the emission side of things. Suppliers and manufacturers need to decarbonise their operations, and they support the transition to low carbon or decarbonised healthcare. Through this up, actually, I found this and I thought it was really good. It just shows how the whole piece can be integrated. It's an organisation called Orly. They're a consultant who are looking at building hospitals within the NHS, and they look to show how all this stuff can be integrated together with the circular economy, from the design and manufacture of in their case buildings, but integrating it with circular economy and making all that everything reusable, and looking at different methodologies being integrated, such as heat storage and heat exchangers, etc., to look after the heating and of the buildings that healthcare would be using. The key thing then from my perspective is then how can health tech contribute to sustainability? First thing I think is design for manufacture. I think it's really important that organisations like ourselves, we build devices that are robust, that'll last, that aren't being having to be replaced frequently. Our devices, for example, we put a 2-year warranty, but our devices are lasting in excess of 3 years with a 0.5% breakage rate. We designed that in from day one and made sure that the quality of the devices are fit for purpose and usable, and will be usable for quite an extended period. Low energy devices is important, making sure that for example, our device shuts down after 30 seconds. 2 AAA batteries will last for 20,000 uses, or approximately 2 years. So maybe we built that in whenever we were looking at all the different aspects of the device and taking advices from healthcare professionals. Designing non-waste generating devices, so making sure that the devices aren't going to rely on single-use plastic consumables. That's important, and that can be designed into devices. Developing non-contact technology that reduces the risk of infections, because devices which don't touch patient to patient makes a significant impact on sort of the transfer of infection within the hospital environment. It also means that it can save nurses time from a cleaning perspective, and using chemicals that are damaging to the environment. The need for those get reduced as well. So talked about the circular economy as opposed to the vertical economy. With quality of manufacture, building devices to last means that there's going to be that less wastage from the end of life devices. No consumables, tackling the plastic problem by lowering the use and the whole life cost of devices. And we'll show you in subsequent slides how we address all these points. Design non-waste generating devices. Waste reduction frees up the recycling of resources. Develop non-contact technology, again reduces the cleaning frequency, as I mentioned earlier, the use of damaging detergents and chemicals to the environment. Consider local time and friendly suppliers to reduce carbon footprint. Again, what we've done with our devices and our next generation device, we're bringing it closer to our own site here to make sure that we reduce the cost of transport and the impact on the environment. Just a visual representation then of linear versus circular. Some of those points I made earlier, making a device, bringing it around through the cycle and bringing it back into to recycling and reducing, versus the more linear approach, which is the take, make, use, dispose, and then goes to pollution, goes into landfill, etc. Sustainability, well, technologies for efficient delivery of care. Again, sorry, and I am repeating some of this, the messages here, but please bear with me. So reducing cleaning and give back time to care. I think that's an important byproduct of this approach. Thinking about when there can be multiple impacts, i.e., giving nurses time back. We estimate that our device has been used exclusively in an 800 bed unit, can contribute 17.4 FTE of nursing time back to healthcare for redeployment, because existing devices which touch patients use single-use plastics. There's a lot of additional time that it aggregates up in the day-to-day use. Our devices don't touch the patient, they're offered up, they take temperature, that's it. Transcription happens thereafter. Non-waste generating devices, reducing waste at nurses' stations, reducing infection risk. Devices being fit for purpose, developing devices in consultation with healthcare teams. We recognised early that the people who knew best about how devices could be deployed and how they were used was the people at the coalface, i.e. nurses. And we use focus groups in the development of our devices. Developing devices that are less disruptive for patients, comfort and faster patient recovery. I think that's more, building that into the design side of things and making sure devices are best, give the patient a good positive experience and help them in the recovery side of things. Designing connected devices for efficient transfer of data to help support efficient decision making and monitor devices and their impact on the environment. And building easy to use devices, enabling care in the community and at home. So our devices are being used in virtual wards across the UK, finding that they're much more user friendly, that hospitals don't have to continue the logistics of supplying consumable plastics, etc. from them. Again, we talk about the plastic problem. A device can be used, a thermometer, a simple thermometer that we build, can be used 10,000 times per year. And that's 10,000 single-use plastics going into the environment. We've done our modelling shows us that I talk about an 800 bed unit. That's kind of the currency we talk about. That will produce 5 commercial skips of single-use plastic waste per year, either going to landfill or incineration. It's about 2 metric tons. and it's totally avoidable plastic waste. It's generated with existing thermometry solutions. Reviewing manufacturing processes is important too, to ensure that all the elements of the manufacturing process are as green as possible. So this is our device. It's the Tri-Temp non-contact thermometer. Some of the cost savings that are associated with it, on top of the impact it's making towards the environment, or reducing the use of single-use plastics. We estimate that just in single-use plastic probe covers, we can save a hospital £140,000. That's GBP per year, and or €160,000, or about $170,000 per year, by removing plastic probe covers. And that's the plastic probe covers on the right, which are used by existing Thematic thermometers. So there's no consumable cost because they don't touch the patient. They don't need the single-use plastics. There's no contaminated waste. We build our devices extremely robustly. I mentioned we have 0.5% breakage rate, and we know that current existing market leader devices are turning over 100% of their devices per annum within the hospital environment. So some of the pain points, I guess, from a sustainability point of view, since the beginning of COVID, the increase in plastic waste being generated by hospitals has rocketed. We address these points with the fact we don't touch patient, we don't use single-use plastics, and as a result, there's none of that. There's millions of plastic caps aren't being used per year. We're under pressure to get to net zero with regard to CO2 emissions. Non-contact technologies offer the opportunity to minimize single-use plastics on a massive scale. I mean, I talked about that 800-bed unit, and I talked about 5 skips of plastic waste. It's actually about 3 million plastic probe covers per year being used by that hospital system. We take that out of the equation and we reduce all the CO2 emissions associated with it. Finding new ways to provide optimal sustainable healthcare. We reduce the environmental footprint at the same time by helping with more robust design in our processes. Staff are getting frustrated by increased cleaning measures, and that's consuming their time. Because our device doesn't touch patients, it doesn't need to be the same cleaning rigor between patients, again giving back significant time to nursing staff. So how can we help you? Here's some. I'm just going to repeat probably some of the data that I've already mentioned. The NHS creates 133,000 tonnes of plastic waste per year, and only 5% of that is currently recycled. An 800-bed unit trust uses about 6 commercial skips of single-use plastic probe covers per year. Tri-Temp non-waste generating device. No plastic probe covers are required when using Tri-Temp. It's a low energy device, as I mentioned, 20,000 uses per year. Then it's the 2 AAA batteries will last. And we can help NHS and other healthcare environments address some of those problems with plastic, single-use plastics, etc. Key benefits of our device, as I say, it doesn't touch patient, reduce contact, saves time from workflow, creates workflow efficiencies. We mentioned an 800-bed unit can save about 17.4 FT of nursing time per year because of the more simple methodology around taking temperature. Saves cost, removes the costly probe covers, so there's cost being saved, time being saved, and it doesn't use single-use plastics. So again, it's having a positive impact on the reduction of contaminated waste. So I guess from an organizational perspective, healthcare needs to become carbon literate, or any organization needs to become carbon literate. And again, I'm repeating what the previous folks had said. Change organization culture, collaborate and learn from other industries, partner with those who have had success, join similar companies to achieve aims, follow a framework to set targets, and follow a framework on the disclosure and progress. I guess to conclude, all can take action towards this the goal of net zero, and healthcare can show leadership and for a low carbon, climate smart environment. And we as suppliers are there to partner and to help and ensure that we design products and devices that can address that at source to ensure that those goals are met. That's me, and there's my email address if anybody wants to reach out at any point.
Yeah, super, Paul. I have just immediate questions like, how long can the tree temp be used, and how is it? Can you stop sharing your screen?
Okay, so yeah. Tell me
Yeah.
why.
So how long the tree temp can be used, and how is it then stored, recycled?
Oh.
What happens after it?
So great question. Our devices, we have devices that have been deployed since in market and hospital systems since 2019. Devices are still being used. So we warranted for 2 years, but actually we know hospital systems that have been using for 3 and 4 years and continue to buy and you know, as devices get broken or whatever.
And what happens when it's like, how do you?
Oh,
like it's no waste generating, but how is it no waste generating? So when its life ends, how do we store it? What happens then? Can we repurpose it?
Okay, great question. So it's not waste generating from a single-use consumable perspective, but it's a plastic device. It'll have to go through a normal recycling process, as any other plastics would do. But most of the materials are recyclable in the device.
Okay. All right. And what I picked from what you said was, well, this also become climate literate, right? Like that was the first bullet point. So maybe again, coming back to this, like where to start, and I think like, yeah, becoming climate literate and understanding the impact and understanding the scope 1, scope 2, scope 3, and all this. So what was your experience? What was your journey? How did you become climate literate? What was your enlightenment moment?
Yeah, look, I think like everybody, we understand that I guess we can't avoid it. I think we all understand that we have to address climate wherever we possibly can. I think, and we've looked at our manufacturing partners, etc. We look at their credentials. For example, we subcontract our manufacturing. They're platinum EcoVadis platinum partners, so they ensure they source from sustainable sources, etc. And they work to reduce their footprint, etc. through transportation. And we're bringing our manufacturing closer onshore as we go forward with our next devices. So we're working on it. We're like everyone else. We're working our way through it, and we're ensuring we build as much into our packaging, our packaging, our footprint, our transportation, etc. as we can. So we're looking at the various scopes of the element, and again, we look at our buildings, and we're building out changing lighting, etc. And we're changing where we can. We have our teams talking to each other and looking for opportunities just in our day-to-day move as we move forward in our normal operations.
Thank you so much. So then we have some minutes for additional questions and comments. I see that at the top of the hour, many people have to leave. That's how. But maybe I will just pull something that I was taking notes when listening to all of you, and had some here my bullet points or the bullet points that so where to start, and then maybe they were like not ideally grouped and clustered yet. Well, changing mindset or this culture in the organization, like you, Paul, said, it was changing mindset. What Christina said. Setting the political objectives, so of course then having this in the policies, as in the case of Southern Denmark or in the US, or also generally like now actually COP29 is going on, so that helps. Convincing clinicians, so of course working with our own staff, become carbon literate, need for savings, and yeah, check like seeing what's the low-hanging fruit. So I think also when we discussed this during the winter, for example, last winter, or during the energy crisis in Europe, I think many hospitals went for that need for savings and this low-hanging fruits of saving energy. But then also having this metrics, data, understanding impact. This is also something that I wanted to still come back to Christina, for example, but because you mentioned about also collecting data on the new experiments with the gloves, for example, track the trends across the organization. So this is what Shane mentioned, also having good data and understanding what's going on. Of course, like innovating and not innovating alone, but innovating within the ecosystem, having actually like the different organizations like the companies and the tech institutes around. Of course, governance structure, so leadership, smart goals, and then just to hear for now, of course, having collaborations, again, for those innovations, for implementation, for support, for learning, and create a business case so that people cannot say no. I don't know if there is anything that you immediately think that is missing. Anyone, not only the speakers. Something that is completely missing here.
Yeah, I think I'd make the point that it's, I think I said it, I guess sustainability doesn't have to cost the earth. I mean, there are so many byproducts by being diligent around the environment and its impact. And that's one of the things that says, like, to use our example is that we're lower cost at every level from the existing solutions that are out there. Our device is lower cost, or we take out the sort of the single-use plastic. So, you know, there's an opportunity, and the opportunity is to save in both. It's not, you don't have to trade one off against the other. I think that's kind of a misconception that we experienced when talking to end users on quite a number of occasions.
Okay.
I think something that I'd like to add is really just when you're talking about this and the engagement is the continuation, and as mentioned, kind of linking it to the healthcare imperative, linking it to the mission of the organization, to the vision of the organization, and not even immediately going to climate action or waste or anything like that, but sustainability as a core component as our duty as healthcare professionals. And one term that I even use, and as simple as it is, I say sustainability is healthcare. And like, that is it. Like, it's rooted, every aspect of it aligns with what we do to treat those, through patient care operations, through everything that we're doing. So it's just it's something that should just be aligned in all aspects, and it's always a, I think, strong talking point and kind of unearthing it and immediately linking to health. I think, and that's the pursuit.
And sustainability is also so well-known concept, right? For sure. Better even than zero net healthcare and those. But maybe just one question to Christina. So on this metrics and data, and how you as a region, who supports you in collecting all this data and making sure that actually you have all what is needed to take decision and based on everything.
I can see that Christina is maybe talking to somebody else, but I know that we have.
Okay, you go, Karen.
We've employed colleagues in the region who help us do these life cycle analyses and bring the data that we need to make these decisions and to kind of understand the impact that the changes that we make have. So we have in-house resources to do that. But it is a challenge also within some of the fields that are very complex, for example, medicine and so on. So it's something we're working on and something that really should be shared across everyone. How do we actually make these calculations to figure out the impact that we have?
Right. Are there any other comments or questions or something you would like to add? I invite you to connect with each other and follow us also on the ECH Alliance. So we will come back with the next thematic innovation ecosystem actually in person during our Digital Health and Wellness Summit in Barcelona, which is on the 28th of February. It's in person only event, not because we are exclusive, but it's in person. We simply, for technical reasons, we cannot bring people online. So if you plan to attend, let us know. And there we will have a session on the pioneers and champions of green health. So we continue with that, and also before summer, we plan to have another session on green skills. So how to convince the clinicians and how to work with healthcare professionals, but also with the leaders of the companies on this climate literacy, let's say. So thank you for today. I wish you a wonderful day, wonderful evening, and we are in touch. Thank you, and congratulations on the great work done.